So this survey that's come out from Otago University, which says that basically, shock horror, the public health system isn't working, is it as bad as it's ever been now in terms of ordinary New Zealanders needing specialist assistance and not getting it? Or is it just symptomatic of a health system that's been like this for the last 20 years?
If you talk to any general practitioner, they've been aware of this issue for a number of years now. I think the thing about this report, it's the first time that a study's been done into the size of the problem and what's actually going on. So, across New Zealand every year, there's about 600,000 referrals to specialists and specialty services and hospitals in the public system. As you mentioned, about 14% now, 14.2% are now getting declined. So that's about 85,000 a year. Patients are not getting access to secondary care when the general practitioner thinks they should. So it really uncovers a situation that hasn't been apparent or hasn't been transparent, because we focus on the waiting list, those that have got through the first specialist assessment, they're on a waiting list to be seen or to have a procedure. This is the group of people who don't even get past first base and are rejected because of capacity within the system. So it's a long-standing issue. It's an issue that's getting worse, and it probably is starting to get pretty close to a sort of crisis-type situation.
Yeah, I'm thinking particularly of mental health and the access to psychiatrists in this country, and psychologists for that matter. And that's, I think, identified by the researchers as a real issue as well, and I have no doubt that is 100% true. But the other thing that shocked me, and I'm interested in your response to it, is when you broke it down into regions, and you would think that the poorer regions of the country would have the less access because that's just the way things are. But in actual fact, it was the southern DHB that led the charge in terms of not having access to specialist service despite GP referrals. 54% of referrals were declined in 2022 compared to the national average of 14%.
Yeah, that was a very, very striking figure and a very striking thing that was uncovered. We know there's been problems in the southern half of the South Island, and it's one of the biggest rural districts in New Zealand in terms of access to specialty care. They've popped up repeatedly throughout the media, and if you talk to anyone down south, they've been aware of the problem. I think this shows the scale of the problem that has developed in that area, which is quite alarming. But I think the other thing it really points to as well, from a national perspective, there is huge variation in terms of what's actually happening here. So that common colloquial term, postcode lottery, in terms of where you get your care, is really being shown up in this research. And there were some absolute outliers, and certainly the Southern District was one of them.
Yeah, but that's just extraordinary, because the next one, if you drop down from Southern District Health Board, the next worst is Mid-Central, which is what I think Whanganui Manawatu, and that's at 26%. Well, that's bad enough. 1 in 4 don't get to see a specialist. But then you've got Wairarapa, which is not a rich area. Well, it's got Martinborough, but it's still not particularly socio-economic at the top of the tree. That's lowest at 3%. What's the story?
Look, it's variation. I mean, I suppose at the end of the day, you'd have to reflect back on the DHBs and the way they are run in sort of a semi-competitive environment in terms of resourcing and funding. And it was a system that was really, really struggling. And I think this really starts to show that up in terms of what was going on in the system, that there was no consistency in terms of what was happening. I think it also points to the fact that in these areas where this type of thing was going on to a greater or lesser degree, there wasn't focus on resolving the problems. And I think this is a problem we fall into with the New Zealand health system, that we keep thinking in terms of 6 months, 12 months, the immediacy of this problem. We're not thinking, well, we've got a growing population, we've got a population that is ageing with more comorbidity, more need for intervention and medical help. And we're not planning sort of 2 years down the track, 5 years down the track, 10 years down the track in terms of what type of capacity we need to actually address these issues. So I think the part of the issue here is this has just been not transparent. It's just been covered up. It was just allowed to continue over time, and it's never been apparent.
Listen, the thing I'm getting a bit angry because, and I'm sure you are as well. Well, I mean, I know professionally you can't, I can. But I'm getting angry because this must have been known within the health system and the people that we pay large salaries to, sitting in head offices in Wellington, to provide public health to all of us in this country. It required, I'm talking to you now because a group of Otago University researchers went and did their job. Why isn't this information, A, gathered on, a relatively regular basis in Wellington? I'm presuming it is. And then B, made available to the political masters who then provide the health funding in the budget, i.e. Ministers of Health?
Look, I think you raise a really, really good point on the need for accurate data on what's going on. One of the reasons we did this research was we were aware, coming from right across the country, from the primary healthcare organisations, the general practices themselves and the general practitioners, that this term we use, unmet need, that is people who can't access secondary care, was a growing problem, but it wasn't apparent in any of the statistics or the data that was out there. It wasn't collected. So certainly data is collected on waiting lists, those people who get through the system and are on a waiting list, but this type of information has never been available. So that was one of the reasons for doing this research, and it's uncovered it, and I think it's very, very timely, because this is certainly something we will be discussing with Health New Zealand, with the Ministry and with the government about the need to actually start to actually track this data very, very carefully, because I think it really is almost the canary in the mine. It starts to tell us how well the system is actually working and what's actually happening. The fact the numbers are going up over time, I think, is the real concern here, because we should be tracking these down. If we knew
I can almost see the health bureaucrats, Bryan, arguing, bloody GPs, that they get somebody then that's 15 minutes, that's easier to get rid of somebody, we'll refer you to a specialist, and sort of putting the blame back at GPs. Is there that kind of cavalier approach to accessing a specialist in this country?
Oh, look, no. You talk to any general practitioner across the country, they take their job very seriously. They advocate for the patient, and a referral is in their professional judgment, and most GPs in this country are very highly trained. Their professional judgment is required. And, look, I hear story after story after story of patients who, can't get a specialist appointment for something that's happening. The GP thinks this is serious, and I heard one 3 or 4 weeks ago. The GP has actually said to the patient, look, you need this procedure, you need, in this case it was a colonoscope, I am going to tell you to pay for it and go privately and get it done. And sure enough, they got it done, and there was a bowel cancer sitting in the bowel. Because clinically, that's what was indicated, but the system was saying we don't have capacity to carry this out. So, no, GPs take this very, very seriously, and if they refer for a reason, that they have a concern about the patient. They actually need secondary advice, or they need a colleague to give some advice on management going forward, because they feel it's sort of getting beyond their scope in terms of what's happening, and there is a need for them to have secondary input. So, no, So going back to your original question, no, GPs are very judicious in what they do here. Yep.
Yesterday, the Minister of Health, Dr. Shane Reti, announced what seems a piddly amount of money in terms of the huge health budget, but nevertheless an extra $30 million, where GPs can refer patients for diagnostic scans like CTs and X-rays directly without seeing a specialist. Is that likely to have any effect upon this, and is it a good idea?
Yeah, look, it is a good idea, and I'm actually pretty complimentary on the government for taking this step. Again, it's something we've been talking about with the government for a long time now. That, look, I'll parallel it with a builder. Look, if you've got a builder and they're building a house, they need a power drill to do their job. What we've been finding around the country is a lot of GPs are hamstrung in what they can do because they don't have access to the tools they need. And in this case, radiology, that is X-rays, ultrasounds, CT scans and MRIs. And this has been an ongoing issue, because if you see a problem that requires one of those interventions and you can't access them in the community because the patient can't pay for them, then the only place you can send them to is an emergency department or the hospital. So it was a ludicrous situation we've got across the country. So in some parts there were schemes running to address this, in other parts there weren't. This is now going to be rolled out over the next 2 years across the country, and I think it's absolutely the right thing to do, to get timely access to investigation, to allow GPs to do the job. And, you know, if you think about it, if I have to send to a specialist to get an ultrasound done, and they go see the specialist and they say, yeah, let's do an ultrasound and come back and see me, that's 2 visits when it should just be 1. The GP can do the scan, say, yep, you've got a problem, need your gallbladder out, off you go to the surgeon. Saves time, it's efficient. Why we haven't done this a long time ago, I'm not sure, but it's absolutely the right thing to do.